Welcome to another show of the Lincoln Commission on Human Rights. My name is Francisca. I'm a community outreach worker for the City of Lincoln. Today we have a great show for you. We have Suzanne Mueller from the Ponca Tribe of Nebraska, Ponca Health Services. And we're excited to hear about what kind of programs they have. So welcome, Suzanne. How are you today?
I'm doing well. Thank you for having me.
Thank you for taking the time to be here. I know you're a very busy individual, but please introduce yourself and what your role is with the Ponca.
Okay, my name is Suzanne Mueller. I'm the Patient Experience Coordinator for Ponca Health Services. I've worked for the Ponca Tribe for the past 10 years. Actually, July was my 10-year anniversary working for the tribe. Yes. So currently right now, just a Patient Experience Coordinator. I was a community health worker prior to that for the tribe.
Great. So you've been there 10 years, wow, and there's been several changes with the Ponca Health Services, right?
Definitely.
Yeah.
We went from having our office on 17th and E, small building, and then moving to Windhoek Drive down south. And that is like triple the size of what we were at before.
Wonderful. So then currently is the Ponca Tribe still at the 17th and E? Is it
So that building itself is on trusted land and it is still owned by the Ponca Tribe of Nebraska.
Oh,
and
that's
so
great.
so eventually I think there'll be other services there. Not sure how that's going to look in the future.
Okay, well great, because that is a really cool building. I've been in there. And that building has been there for so long.
Yes, it has.
So it's awesome. And so tell us a little bit and describe, because you just went from a small building to a bigger facility.
Yeah.
Please talk a little bit about what that facility has, what it has available to the community.
Okay. So it kind of like, it's kind of a visual walkthrough, I guess I'll kind of give you. And so when you walk in, on the east side of the building under the cedar canopy, you enter in and it's a beautiful open spaced area.
Nice.
A lot of light coming in. And on the right side you walk in and you'll see pharmacy. So we have pharmacy services. So anyone that's receiving medical care can go and pick up their prescription after their appointment or have refills on their medication. On the right side, you're going to enter into tribal affairs. So tribal affairs, we have lots of services over there. I can start with, human resources is served over there. We have IT, we have EPA, risk management, tribal enrollment, we have transportation, we have culture, marketing. We have so many different things over there. I'm trying to think what other services we have housed in that area. Oh, grants compliance. I can't forget about that. Yes. So that's tribal affairs. And then you go into the medical side. We have medical, we have dental, we have behavioral health, and human services.
Wow.
Yes.
That is a lot.
Yeah.
And I haven't been to the new space, but I have seen some pictures of it, and it looks beautiful.
Yeah.
And it's wonderful that Ponca Tribe and actually health services has been able to expand, because I know that in the previous building it was so compacted.
It was compact.
So first of all, tell us how is the Ponca Tribe and Health Services providing those services for our community? Is it just for Native Americans? Is it for the community as a whole? I think that community members would find interesting what it's doing.
Absolutely. So we serve all federally recognized tribal members. So I know it's kind of deceiving when it says Ponca Health Services, but we serve all Native people in our community. So the Ponca Tribe, a little bit of history with the Ponca Tribe, they were reinstated October 31st, 1990. So we have 5 different area locations. We have one in Omaha, Lincoln, Norfolk, Sioux City, and the main headquarters is in Niobrara. We have 3 health clinics. The health clinics are in Omaha, Lincoln, and Norfolk.
Okay, so it's a pretty big organization.
Yes, it is.
And I don't think a lot of people realize that it's not just here in Lincoln, and that the services that you provide as an agency are spread out throughout the state. When the Ponca Tribe was reinstated, did that also include making sure that all Ponca Tribe members had access to health care, mental health?
Yeah, absolutely.
That's wonderful.
So those served in our service delivery areas. So the mental health component, you know, it's hard everywhere.
Yeah.
And I know that we have all our behavioral health services are in all 5 area locations. So whether we have an office location in Sioux City, we have people travel to Sioux City to visit with patients, or in Niobrara, since we have the 3 clinics in Omaha, Lincoln, and Norfolk. So they do travel to visit other tribal members in that rural area, I would say, up in Niobrara. Yep.
Wow, that is really awesome.
Yeah.
What other kinds of programs or events does the Ponca Tribe have that that would be more for the community to come and really remember that, first of all, you know, the Ponca were already established here in Nebraska way before we came, but to continue to educate people on that history?
Well, we do have a powwow every year. So we actually just last week they had their 30th annual powwow up in Niobrara. So that is an activity that a lot of folks can go to. You don't have to be a Ponca member. It could be anybody actually can go up there. And it's not just strictly Ponca. It's intertribal. So you can go up there and visit that once a year if you want to learn about the culture. We also here, if we're going to talk about strictly Lancaster County, we have elder lunches, we have youth activities, we have our wonderful gym that we have at Windhoek at the Ponca Health Services for you know, free gym membership, basketball. So we have quite a bit of people coming in enjoying that I guess benefit of the Ponca Tribe.
Absolutely. And I'm sorry, just to be clear, those benefits are not necessarily just for the Ponca Tribe,
It's
or
for
everyone.
Yeah.
Okay, so
absolutely.
if somebody wanted to go into the facility, how would they go about it? Would they just go in and talk to somebody in the facility, or what's the process for that?
Okay, so if you want to use the medical services, you know, either you can call or you can just pop in and fill out a registration form. They try to make it as convenient as possible for our clients. I guess over the phone, they can do just an over-the-phone application, and then when you come in, you can bring your supporting documents. So it's very simple. But we also, I think I forgot to mention, we do have a benefits coordinator on site. So a lot of the benefits, whether if somebody needs Medicaid, SNAP, Medicare, marketplace enrollments, she's always there to help assist any of our clients here in the community.
That is so awesome. And I know that even though, I mean, obviously the Ponca Tribe Health Services is, I mean, we want to gear it to Native Americans, but if there are community members who would like to, you know, go to your clinic side, and if there's a language barrier, do they need to make sure they provide their own translators?
We really haven't had any issues as far as translation where we're at. I think a lot of our the staff that we have on hand are always ready to assist, whether it be our community health worker or just staff, because some of our staff are American Indian staff members, so they can relate in educating those that are not American Indian. Our staff is able to educate them, and even our culture department, since they're on site, anything that they need. But really, we don't have a lot of issues as far as translations.
Good.
Yep.
Oh, that's awesome.
Yeah.
So talk a little bit more about what your role is with on the side of the Ponca Health Services.
Okay, so as my role, I'm a patient experience coordinator. So if we have any patient complaints or even good feedback that we have at the health clinic, I am there to support the patient. I am the advocate for the patient. And so, which is really nice. Also, I do create surveys for the health clinic, but not only do I, under my role as a patient experience coordinator, I do work under the Minority Health Initiative grant. in advancing health literacy.
Okay.
So I have a staff member underneath our umbrella. We work and we provide services that are required under that Minority Health Initiative grant. So it's really, really beneficial. And I've actually worked on that Minority Health grant for many years. I can't even tell you what, probably 8 years we've had that grant under Ponca Tribe. So it's been really beneficial for our community.
Wow.
Yeah.
That is so awesome. So in addition to that, I think, excuse me, as we were talking earlier, you're part of the community, so what is it, the community centers or the
Cultural Centers of
centers,
Lincoln.
excuse me,
Yep,
sorry.
no, that's fine. Yep.
Yeah.
So the Cultural Centers of Lincoln, I think Tom had talked about that earlier, about how the Ponca Tribe came in later. And so we started meeting on a regular basis, and what a great group we have. We all work together. We try to, if there's certain grants out there that we can all team up on, and like, if, for example, the Minority Health Initiative grant, we work together. And I should say, like, even if when I say it's only American Indian people that come to our facility, we hold our minority health meetings there with the cultural centers. We try to educate each other on each different cultures that we have within Lancaster County. So it's really nice. So we learn about one another as far as culture. So yeah, they're able to come use the facility for rental space if needed. You know, we're really open and we're very flexible with the other cultural centers. So,
That's
yeah.
great.
Yeah, it's really great.
So now, in talking about, you said there's some like space for meetings. Is that that meeting space available to maybe some agencies who would like to hold a meeting there, or is it very specific to?
No, actually, we've housed different meetings with Lancaster County Health Department. I know Environmental has had a lot of meetings over there. They do use it for community members to have like birthday parties or graduations or different things like that. So it's very, very nice. We do have our tribal council reps. So we have 2 tribal council reps for Lancaster County. And so they host like monthly like meetings, not even like, I wouldn't even say meetings, but just gatherings for Ponca members within this district. And so it's getting utilized very well. The community space is very large. We have all technology. We have a kitchen. Sometimes I think there's fundraisers, different things going on there too. So
that sounds wonderful. If someone from our community was interested in going and maybe taking a tour of the facility, who would they reach out to?
That would be me.
That would
so
be
yes,
you.
I can't tell you how many how many tours I've given at the Ponca Tribe.
Okay.
It's been amazing, and I don't think people really realize what a wonderful space it is. You know, they think 17th and E is the location, and then when they come see the new space, they're like, wow. Like, their eyes are big, and they were like, you guys, this is beautiful. And it is beautiful. We are very lucky to have the space that we have. We're very happy that we're able to help our community members here in town and creating that collaboration within the city. So it's really good.
That is awesome. I think we need to take you up on that.
Yes, anytime.
Through our commission.
Yes,
that
that would be
great.
awesome. Anytime.
If our community wanted to assist or help, whether it's donation, monetary donation, I didn't ask you if you take any other type of donations, but if it's monetary, how would they go about that?
So that's a little different situation. A lot of times we'll work with our grants department. So our grants department will create fund codes for those monetary donations. So we've been working with Bryan Health. Bryan Health has been really great about that. And so we worked with Bryan Health with our grants department to get that established in our finance department. So the only thing is our finance department is all the way in Niobrara, so it's just communicating via email or on Zoom or LifeSize that we have. But you know, that's how we establish those monetary donations. And like if you were to just want to donate money to the Ponca Tribe, you would contact our finance department, and they would allocate the funding in the right appropriate, I guess, bucket or whatever it may be. Yeah.
That makes sense. Does the Ponca Tribe take any other donations other than monetary? Is there a need, in other words, that, you know, you would benefit, the Ponca Tribe of Nebraska would benefit? And I usually think of like winter's coming, you know, if somebody maybe wants to do a drive for coats or anything like that, because I know some of the cultures do that, what would be the process, or is there even a process put in place for that?
Yeah, I think at the Ponca Tribe, there's a lot of processes that we have to follow. I'll give you an example. So we work with the hygiene network for our elders. And so that's, so I'm in charge of that hygiene closet for our elders. And so just creating that contact person. So if you wanted to do a coat donation or I guess, just donated a whole bunch of coats to our community, you would probably want to contact Human Services, because that's kind of along their lines of work.
Absolutely.
And they can contact some of those that are in need of coats, or our community health workers. But finding that contact person is really important, who has the time to maintain and keep up with those things. So yeah, like as far as collaborating, we've had a lot of great collaborations and donations. I know Hygiene Network, they gave us feminine products. We've had, I'm trying to think what else. We have diaper distribution. We also have, Human Service has monthly food distribution, and it's for all natives. So it's very, very nice to have that once a month, and that's supposed to continue throughout the winter months. So it changes with the season. So yeah, so anything like that, if you were to donate anything or have some kind of fundraiser, whatever it may be, I know the Ponca Tribe would be more than happy to help with that too, and get that going.
Awesome. That sounds awesome. Anything else that you think we need to know as a community? Whether it's about your facility, the Ponca Tribe, that maybe we really don't talk about?
I think there's a lot. I think sometimes we kind of, our people kind of get put on the back burner on a lot of things, and I think that having a little bit more conversation about what we're doing in our community would really be important. Sharing all the great things that the Ponca Tribe is doing for our people here, not only here in Lincoln, but throughout Nebraska, mainly the eastern side, because that's where all our service delivery areas are. But just knowing all the great things we're doing, support is really important, you know, and communicating things that are going on in the city with the Ponca Tribe. Yeah.
That we have to make a note of that then, to make sure we have good communication with the Ponca Tribe.
I think it would be good.
Well, Suzanne, thank you so much
for
taking the time to be here. I think it is important that we continue to learn about the Ponca Tribe of Nebraska and the health services. The number for the Ponca Tribe and contact information and website will be at the end of the show. And I would like to thank you very much for being here with us today. And just make sure that if you have any kind of monetary donation, that you follow through with going to the website for the Ponca Tribe. And with that, we say thank you, and remember, we all have rights.